Cabotegravir is a new injectable medication for HIV prevention that could be a game changer in protecting people against AIDS. It belongs to a class of drugs called integrase strand transfer inhibitors, INSTIs, that block the virus from inserting its genetic material into human cells. Cabotegravir is given as a long-acting injection every 2 months instead of a daily pill, which makes it more convenient and discreet for people who want to prevent HIV infection. Cabotegravir has been shown to be highly effective in preventing HIV infection in 2 large clinical trials that compared it with oral tenofovir disoproxil fumarate and tricidabine (TDF). FTC, the current standard of care for pre-exposure prophylaxis (PrEP). The trials included cisgender men and transgender women who have sex with men, and cisgender women who are at risk of acquiring HIV. In both trials, cabotegravir was superior to TDF, FTC in reducing the risk of HIV infection, with an incidence rate of 0.41 per 100 person-years in the cabotegravir group and 1.22 per 100 person-years in the TDF, FTC group among men and transgender women, and 0.21 per 100 person-years in the cabotegravir group and 1.79 per 100 person-years in the TDF, FTC group among women. Cabotegravir was also safe and well tolerated by most participants in the trials. The most common side effect was injection site reactions, such as pain, swelling, or redness, which occurred in about 80% of the participants who received cabotegravir injections. These reactions were usually mild or moderate and decreased over time. Other side effects were similar to those of TDF, FTC, such as headache, nausea, diarrhea, and fatigue. Cabotegravir has been approved by the U.S. Food and Drug Administration, FDA, for use in at-risk adults and adolescents weighing at least 35 kilograms, 77 pounds, for PrEP. It is also recommended by the World Health Organization, who, as an additional HIV prevention option for people at substantial risk of HIV infection. Cabotegravir is expected to increase PrEP uptake and adherence among populations that face barriers to using daily oral pills, such as young men who have sex with men, transgender women, and women in low-resource settings. Cabotegravir is a promising new tool in the fight against HIV and AIDS. By offering a long-acting injectable option for PrEP, it can help reduce the number of new infections worldwide and improve the quality of life of people who want to protect themselves from HIV. Some state attorneys general are also fighting back against a court ruling that restricts access to mifepristone, a safe and effective prescription abortion medication that can prevent unwanted pregnancies and reduce the risk of HIV transmission. Mifepristone is a pill that blocks the hormone progesterone, which is needed for pregnancy to continue. When taken with another medication called misoprostol, it causes the uterus to contract and expel the pregnancy tissue. Mifepristone has been used by millions of women around the world for decades and has a safety record comparable to that of aspirin. It is approved by the World Health Organization and the Food and Drug Administration for early abortion and miscarriage management. However, in some states, mifepristone is subject to harsh and unnecessary restrictions that make it harder for women to access it. For example, some states require that mifepristone be dispensed only by a licensed physician in a hospital or clinic, and that the physician must be physically present when the woman takes the pill. These rules force women to make multiple trips to a health care provider, which can be costly, time-consuming, and risky during a pandemic. They also limit the availability of mifepristone in rural areas, where there may be few or no abortion providers. In July 2020, a federal judge issued a preliminary injunction that suspended these restrictions during the COVID-19 public health emergency. The judge ruled that requiring women to travel to a health care facility to obtain mifepristone imposes a substantial obstacle to abortion access and violates their constitutional rights. The judge also noted that mifepristone can be safely prescribed through telemedicine and mailed to patients' homes, as many other medications are. However, in January 2021, the Supreme Court lifted the injunction and reinstated the restrictions on mifepristone. The court did not explain its reasoning, but 3 justices dissented, arguing that the court's decision was arbitrary and unjustified. They pointed out that the court had previously upheld other COVID-19 related measures that eased access to health care services, such as relaxing deadlines for filing taxes and claims for benefits. They also warned that the court's decision could endanger the lives and health of women who need mifepristone. Some state attorneys general are not giving up on defending women's right to access mifepristone. They have filed lawsuits challenging the Supreme Court's decision and seeking to restore the injunction. They argue that the restrictions on mifepristone are medically unnecessary, burdensome, and harmful to women's health and autonomy. They also claim that the restrictions disproportionately affect low-income women, women of color, and women living with HIV who face higher barriers to accessing abortion care and are more vulnerable to COVID-19 complications. These state attorneys general are fighting back against a court ruling that threatens not only women's reproductive rights, but also their ability to prevent HIV infection. Studies have shown that mifepristone can reduce the risk of HIV transmission by preventing unwanted pregnancies among women living with HIV or at high risk of acquiring it. Unwanted pregnancies can increase the likelihood of vertical transmission from mother to child or horizontal transmission from partner to partner of HIV. Mifepristone can also help women avoid unsafe abortions, which can expose them to infections and bleeding. By restricting access to mifepristone, the court ruling puts women's lives at risk and undermines public health efforts to combat HIV/AIDS. That is why some state attorneys general are standing up for women's right to choose and access safe and effective abortion medication.